What's up, everybody? Nolan and Allie are about to get learnt today. Whitney is going to do a Chalk Talk Thursday. She's going to talk a little bit about abdominal separation.
Yep, so we're talking about abdominal separation, super common in pregnancy. In fact, 100% of pregnant women will experience abdominal separation. You have to make room for baby. But it becomes a little bit more of a concern when it persists postpartum. So we're going to talk about a common kind of strategy that is often recommended to, so to speak, fix abdominal separation and why it's flawed. It's going to be a little bit spicy today. And then we're going to talk about what we look for, what we recommend as a more effective, more functional, more natural strategy to close up abdominal separations. So first up, person A. This is what most women look like. It's what we're told will help us with abdominal separation. It's what we're told is good posture. So I'll kind of be a demo here from the side too. So a lot of women were told, what's good posture? You know, suck it in, chest up high. This takes a lot of work and it doesn't feel very comfortable. And this strategy where we have a lot of like that belly button to spine, that sucking it in of our cores, can actually make abdominal separation worse. And here's why. So in this position, we have some inefficient positioning between our diaphragm and our pelvic floor. And I'll give you a little bit of orientation here. So we've got our spine coming down. This is our sacrum, that lowest part of the spine. We've got our pubic bone in the front. Again, this is like a side view. We've got our sternum, our like chest bone, all of our ribs coming down. We have pelvic floor running between kind of that tailbone and pubic bone, our diaphragm muscle coming up here, and then we've got our abdominal muscles in the front and our low back muscles in the back. So you can already see in this drawing, our abdominal muscles are really, really stretched out and lengthened. In comparison, our low back muscles are kind of shortened. So again, this is our belly button to spine kind of positioning. And it's a little old school, but still a very common recommendation for women to strengthen their core is just belly button to spine, just suck that in over and over and over again. And that's supposed to, well, it definitely does activate like some of those deepest core layers, but it does it in a really ineffective way. So here's why this can make abdominal separation actually worse. So these muscles are already kind of lengthened. We have these muscles that are going to work a little bit extra to provide some stability to our core. So if we don't have a good kind of parallel base for our core here, we end up with some muscles doing too much work, some doing too little, and some being a little bit compromised. So with this lengthening, these muscles are not going to be able to engage as effectively as if they were in a more neutral length. It makes it, if you've ever tried to start a lift, so if I don't have a dumbbell in here, we'll pretend this is heavy. It's harder to initiate a lift from the end range maximum length of your muscle than it is from the mid range. We're strongest in the mid range, and our abdominal muscles are no exception to that. It's harder to activate these when they're nice and stretched. So if this is our kind of our default position, and then we add load, meaning like we ask this woman to pick up a child or a barbell or a laundry basket, we end up developing a pretty big energy leak, and it goes right out the front of those muscles. We can't really effectively harness pressure in our abdomen, which we need to keep our spine safe. So what we see is our low back muscles end up doing tons of extra work. We develop a lot of trigger points or knots through our pelvic floor and diaphragm. And then these abdominal muscles, which are already lengthened, are now having extra pressure go out the front. So this is exactly what we don't want to have happen in a woman with abdominal separation. So if we already have some stretching of that middle, kind of midline tissue, and then we say, let's add more pressure through it, it's a great way to make abdominal separation worse or if you're doing some of the other like good things that you need to do, it's going to help prevent more approximation of those muscles. So first thing we recommend is to stop arching your back and sucking it in, and instead get into more of like a neutral position and let your belly relax. You can see when I do that here, how stretched these muscles are in the front versus when I tuck. Now these muscles are a lot, they're under less tension, so they're going to be able to activate better. So that kind of leads us into our ideal situation over here. So you can see, kind of comparing the two sides, we'll start with the front and move our way back. So we already said abdominal muscles here, really elongated, not a great thing. Here, they're much shorter, so we're getting into that mid-range kind of muscle tone. On the flip side, these back muscles are nice and shortened, why most of us have a lot of back tension, especially during pregnancy, postpartum. In this position, they're a little bit more lengthened, which again, you can see as my back is arched, I can feel more muscle tension, and then as I tuck this down, we're getting that lengthening on the back side. So you can already see how this would kind of help eliminate, at least, like very least, back pain would be a little bit less. So in this position, we've got good length abdominal muscles, good length low back muscles. We also have good orientation of our diaphragm and pelvic floor. They're basically parallel here, which is going to allow all of these muscles to work together to help protect your core, help keep your back safe, help divert pressure away from that abdominal separation and more into the back. So if we have this diaphragm muscle lower, because we're breathing in, we're pulling those lungs down, that will increase pressure in our belly. That pressure moves down into our pelvic floor, and the diaphragm and pelvic floor will act together like a piston, so we should see this nice lengthening here. We don't have that over here. We don't get any of that interaction, which is why all those knots and trigger points develop. So if you or someone you know experiences things like pain with intercourse, leaking urine when you laugh or jump or sneeze, this kind of system can produce those sort of things. So when we get on this flip side, this better orientation, these muscles can lengthen and activate in a much more functional, physiological way that's going to prevent all those trigger points from occurring. So we've got this good orientation here, good orientation here. So as that pressure increases in our belly, we already talked about getting more pressure in the pelvic floor. We definitely get some in the front, but we can also get a lot into the back. And that's key for preventing abdominal separation from worsening, because if we've already got weakened tissue, we don't want a lot of pressure coming out. But what do we do instead? Well, we can't just eliminate pressure because we still need to load our core. We can't just stop moving and doing everything that moms need to do. So instead of having it come straight out the front, like in our belly button to spine model, we instead want to divert to especially the sides and the back. This is primarily done through belly breathing, which we have talked about many, many times, but not especially when it comes to abdominal separation. So as our breath comes in, we want expansion into front, back, sides, and pelvic floor instead of just out the weakened tissue in the front. So this is my whiteboard rant about why you should stop sucking it in, stop doing the belly button to spine stuff, especially if you have abdominal separation, as well as some of like the painful intercourse, leaking with exercise, those kind of things. So if this is something that's totally new to you, that's completely normal. It's a little bit more of a recent approach, I'd say, to like core pelvic floor rehab. A lot of people are getting into this, which is amazing that women are getting this good information. But if you're still being told belly button to spine, it'd be a good idea to look to someone else in addition to whoever you're seeing, just to get another opinion about it. So if you have any questions, drop them in the comments below. Send us a direct message. I work with women with abdominal separation and all these issues all the time. So if you'd like to schedule, you can also send us a message and we'd be happy to help you out. Thanks for tuning in.
That was awesome. Did you learn anything, Allie?
Yeah, I try to suck it in too much.
I learned a lot there.
That was good.
Awesome.